Good evening to everyone present here with us today. This is Riyan from IGCP, today's moderator. I would like to welcome all the viewers who have joined our platform for better exchange of knowledge that is going to be shared by our keynote speaker doctors for today's podcast session on endometriosis in adolescents and young women. With much pleasure and honor, let me welcome today's host, Dr. Sharda Jain, ma'am. Welcome, ma'am. Ma'am is the Senior Consultant of Ops and Gynecology Department, Director of Life Care Center and Life Care IVF, Secretary General of Delhi Gynecology Forum, and also a chairperson of North India Forum. Now, with the help of ma'am and her expertise, I would like to welcome ma'am at our forum and would like to hand over the session to her. Over to you, ma'am.
Thank you very much and great good evening. I am Dr. Sharda Jain, Secretary General of Delhi Gynecologist Forum and a Chairman of North India Gynecologist Forum. After this welcome, what is our aim? Our aim is public awareness and to give you evidence-based information by our experts. The talk of today's evening is endometriosis in adolescent and young women. Majority of us feel that this is a disease of adult. इसका टीनेज से कोई लेना देना नहीं है. But at the outset, I want to make it very clear to people who are listening us that the root start of endometriosis right in adolescence. For gynecologists, it is an enigma. It's a mysterious disease. प्रोफेसर लोग कहते हैं जिसको एंडोमेट्रियोसिस आ गया उसको सब कुछ आ गया गायनेकोलॉजी में. You like to know who had been suffered from this particular disease? The great Queen Victoria had endometriosis. Marilyn Monroe had endometriosis. Madam Hillary Clinton had endometriosis. And हिंदुस्तान में बहुत लोग बोलना नहीं चाहते कि उनको क्या प्रॉब्लम है. Katrina Kaif also admitted openly that she had endometriosis. For gynecologists, it is a dilemma. It is dilemma for four things. It's a diagnostic dilemma. It is a debilitating disease. Pain, pain, pain. It's a progressive disease. And it has no cure. It is not a lifestyle disease. It is brought about by chronic inflammation. It is estrogen dependent problem. So I introduce my great experts, Dr. Sangeeta Gupta. Dr. Sangeeta Gupta is a great academician, had been a former professor and head of Basai Darapur, which is the biggest ESI hospital and attached postgraduate institute where she had been the head. And now she is a professor at Saraswati Institute of Saraswati Medical Institute in Hapur. We have another expert, Dr. Renu Chawla, who is a very senior gynecologist, and she is head of the department of Kailash Deepak Hospital, which is a tertiary care hospital. And these two experts, along with me, are going to make things crystal clear, all evidence-based. I have a small girl also. I introduce her. She's Arshia, who came to me this morning, and she was willing to come to you and share your problem. So I will ask Arshia, take a minute and tell what your problem is. Her symptoms are going to explain everything. Arshia.
So, good evening, everyone. My name is Arshia Singh. I am 20 years old, and this is my story. I started having my periods at the very feeble age of 11. Back then, I had no clue what was to become of my life. I have always had very heavy periods, which came with a lot of pain. As I grew up, the pain grew up with me. When I used to attend classes in school, when I used to sit in my class, I used to look around and wonder, why are the rest of my female friends not in pain? Why are they so good at pretending that they're not in pain? Why is there something wrong with me only? Then later on, after I would say a few years, I finally came to accept that, okay, maybe something is not wrong with me. Maybe this is normal. Then I finally decided to visit a gynecologist. Then I was diagnosed with something called uterus didelphys. And for my pain, I was put on the medicine Clyra. Now, the next 11 months that I spent with Clyra were honestly heavenly. I was not in pain anymore. I could live my life. But there was one problem. After the 11 months when I visited my gynecologist, I told her that I was not having my periods for the past 11 months. And this came as a shock for everyone around me. All of them were worried, like, how are you not having your periods? That is supposed to happen. You're a woman, you are supposed to have periods. So again, I started wondering, is there something wrong with me again? But then uh, I stopped taking Clyra. I was put on something else. I started having my periods again. And then for the past 2 months, I realized I was back to square one. I was just having my very severe, very painful periods again. So today only, I visited our very lovely Dr. Sharda, and she told me that there was nothing wrong with me. This is normal. And she listened to everything I said, and she just gave me a lot of hope for whatever my life will become from now. So I think that is it from my side. Thank you to Dr. Sharda, and good evening, everyone, again.
Thank you, Arshia, for telling you the story. Dr. Renu, we've heard Arshia's story. Do you think it's a classical picture of endometriosis presenting in adolescent and young women?
Yes, ma'am, it is one of the presentations because endometriosis is the presence of endometrial tissue outside the womb. That means uterine lining is always lined with endometrium, but when it is present outside the uterus, then it causes problem because the changes will occur in that endometrium with every cycle, and they will lead to all the symptoms what she is having. Since she is having uterus didelphys, which is a congenital malformation, so the surface area of the endometrium is much more. So as it is present in one uterus, it is the double uterus. So whenever she's going to bleed, going to bleed much more, and she's going to have much more pain also. Normally, what happens is during the once anybody has a period, 1 to 2 days before, they'll have small discomfort in the lower abdomen. They'll have some little backache, but that will not cause them so much discomfort that they are disturbed with that. And once with the onset of periods, the pain decreases, and over a period of 1 to 2 days, it disappears. But
So
when there
this is what the main difference of pain which is there with normal periods in 99% of patients, and the pain which is having with endometriosis.
yes.
You explain the people again, Renu.
See, primary dysmenorrhea is which is present in each and every girl during the periods. So what happens is when the period is about to start, people feel little discomfort, especially the girls, they feel little discomfort in the lower abdomen, plus simultaneously at the back. But this pain is very dull in quality, and it does not disturb their routine working or going to the school or going for work. It is not disturbed. So once the period starts, this pain disappears. And sometimes if it does not disappear, if they take mild analgesics and NSAIDs, it goes away. And throughout the month before the next period, they are comfortable. They do not complain of any pain. Whereas when the pain is of endometriosis, it may occur at cyclical intervals, or it may be acyclic, and it is much more, it keeps increasing over a period of time. And it is not relieved with the normal NSAIDs or normal treatment, then we suspect that patient is having something else. It is not the
We're going
dysmenorrhea
to stop it
normal.
here. What you've broken one myth that endometriosis is a disease of adult. It is can start soon after the periods. One thing,
Yes.
Doctor Sangeeta, please let us know that what are the various presentation and how much is the prevalence. Let everybody who's listening us should know about it. What is the prevalence of endometriosis in teenage girls as well as in young women?
The prevalence of endometriosis depends upon the presenting symptom. If we see that a girl who presents with the severe abdominal pain or pain abdomen which is not relieved by routine medical management, there is prevalence 70%, 69 to 70% prevalence of endometriosis. So one has to be very alert that any girl having severe pain during periods or continuous pain which is not relieved with normal periods, there are chances that this girl is suffering. There are 70% chances that these girls may be suffering from endometriosis.
Yes, yes, very rightly you said. It is
And
said that in case if the pain starts before 15 years, almost 99% you'll
yeah,
find underlying endometriosis may be there. And within 20 years, if the pain is there, then again you find 70-75% have a problem of endometriosis.
and
Uh,
again,
and this particular case highlighted that one of the high risk factors are Mendelian anomalies. What are the other high risk factors, Dr. Sangeeta?
so why in Muralian? First I will tell the why in Muralian agenesis or in problems there is high chances of having endometriosis. Endometriosis we think is caused by retrograde menstruation. Means the endometrium which is being shed in our uterine cavity through the tubes, it goes back into the abdominal cavity and it get spread onto the pelvic peritoneum on the ovaries and tubes. Now, once there is a Mullerian abnormality, means there is blockage of the blood to come out of our body and it gets retained and the uterus gets distended. So we know whenever there is anything which is distending, the backflow is more. जब घर में नाली बंद हो जाती है तो पानी उलट के वापस जाना पड़ता है. इसी तरह से whenever there is any abnormality, the blood goes, the menstrual flow goes back into the tubes and it gets stuck into the ovaries. So this again, secondly, there is a genetic factor. It is said that the girls whose first degree relatives are suffering from endometriosis have 7 to 9 times more chances of having endometriosis. So this is my message to the mothers that who have been diagnosed as endometriosis should always suspect that my daughter can also have this problem, and they should be very vigilant about their daughter from the very beginning. Then
So the
third,
yes,
then
yes, go ahead.
immunological diseases, it is also associated. The high other presence of other immunological diseases is also the high risk factor to have endometriosis.
And
So the
sometimes
second,
sorry,
yes,
ma'am.
Renu?
Once
Uh,
somebody is having migraine or somebody is having any other symptoms which are unwarranted, so one should always think कि it is not only the period pain; it can be something else. Some of them present only with gastrointestinal symptoms, and some of them present with difficulty in passing urine at that time. So we should always suspect that why at the time of periods only she gets this kind of a pain. So we should
so
investigate
depending
them
upon where the
thoroughly.
endometriosis is there in genital tract, you will find various symptoms are there, which both of our experts have highlighted. So the second message goes that whenever a patient is not responding to periods pain with the normal NSAID tablets, it means something is wrong, and the child need to be seen by the doctors. Now, this school absenteeism, which Aisha highlighted, how common it is, Dr. Renu?
Ma'am, in almost 10% of the young adolescents, we see school absenteeism during periods. So it could be because of the underlying cause. That is, they are having so much of severe pain that they feel so conscious to go for work because everybody around them comes to know that she's having periods. So that is why they don't want to show it to the public because it becomes a taboo. people laugh on them कि periods तो सबको ही होते हैं, तुम्हें इतना severe pain क्यों हो रहा है? And why? Because you are overreacting. So that is why it is doesn't get diagnosed over a period of time, because of this myth कि पीरियड का पेन तो सभी को होता है. दिस गर्ल इज ओवर एक्टिंग और शी इज ट्राइंग टू मेक अप फॉर समथिंग एल्स, सो इसलिए ये बोलती है कि मुझे ज्यादा पेन होता है. सो वी डोंट हैव टू
Yes, all
इग्नोर
three of us are
इट.
gynecologists, so we know there are two varieties of patient. One is, every month there is a, it's a drama in the clinic that the parents come and the grandparents come. This girl comes with a lot of pain and you have to give them injectable. This was a story 5 years earlier. Now you find that the better drugs are there, doctors are better informed. And the second ones are, the people are in silent. You could see Aisha also telling her that she used to wonder, how come I only have pain and other people are, quietly and happily attending the class. So, this particular problem is there, and the message is very clear. We have to diagnose early, we have to treat early, and they have to be on a long term medical treatment. This is a message to all gynecologists that they have to be on a long term medical treatment if you want the disease to be controlled early, and if you do not want to have a chronic problem or later on land up with a problem of infertility. Dr. Sangeeta, you mentioned about quality of life. So, how does it affect the day to day things as far as this particular child is concerned?
As our that little girl said, that quality of life is very much disturbed. It is because there is problem, there is a physical problem, then there is an emotional problem, then there is a psychosocial problem, and ultimately there is the person or the patient gets disturbed a lot. Now, physical, as Dr. Renu told, that there can be cyclical pain, there can be acyclical pain, there can be pain on urination, during urination. All these type of pain she may present, and since it is a chronic inflammatory process, the energy level of body they drain, and patient is in a persistent fatigue. This persistent fatigue because of chronic inflammation leads to all other problems. वो girl है, she's sitting in the house, she doesn't want to go in for play because she's tired. She doesn't want to take a, then there becomes the social stigma. She doesn't want to interact with others. When she's not interacting with her friends, she's not going on to any social platform, so she becomes an introvert, and she thinks that what is wrong with me. Then her career is disturbed because of this fatigue, because of this chronic problem. She thinks, as our little girl said, that I want to become an astronaut, I want to go for astrology, astronomy.
Astronomy.
But some girls may think, oh, I wanted to become a sports girl, but because of this disease, I cannot. So their career, their academic whole thinking about what they want to become is disturbed. Then there is their social interaction is less. Then ultimately they think that they are not able to cope with their life, and
Yes.
what is wrong with them. So
So
these all
quality of life is disturbed in good 65 to 70% of people, because this is the disease of young people. The young age is for enjoyment, and they find that they're pride of this and they can't manage things. Now, coming again to the diagnosis. Dr. Renu, how the gynecologist clinches the diagnosis? Why we say it's a diagnostic dilemma? Earlier, we say that average in places like England used to take 5 to 7 years. Delay has been there as far the diagnosis is concerned. You could see also in her case also that it took almost 6 to 7 years before her diagnosis of endometriosis was labeled on her, and she was given the right treatment. So how to diagnose these people?
Ma'am, diagnostic dilemma is because of the patient factors as well as the clinician factors. Patient factors include that they are not comfortable telling that they are having pain during periods, because they have been brought up in that atmosphere कि जहाँ माँ भी बोलेगी, दादी भी बोलेगी, सब आंटीज भी बोलेंगी कि ये तो नॉर्मल बात है, पीरियड में पेन तो सभी को होता है, so what is big thing about it? So she is hesitant to come out of that problem कि मुझे इतना ज्यादा पेन हो रहा है कि आई नीड सम मेडिकल हेल्प. सो इसलिए डायग्नोसिस थोड़ा तो डिले होता है, क्योंकि जैसे दिस गर्ल हैज गॉन टू द डॉक्टर आफ्टर 5-6 years. So similarly, clinicians का भी ये है कि they have to be aware of the adolescent factors. मतलब adolescent science अगर उनको सही से नहीं पता है, so they will not be able to see it कि वो जो है कि adolescent में कुछ और problem भी हो सकती है. It is not only the primary dysmenorrhea, it can be
And
secondary
what are the
dysmenorrhea.
factors at a doctor's level?
जी मैम.
डॉक्टर्स के लेवल पे क्या प्रॉब्लम्स है? व्हाट
मैम
हाउ इट
डॉक्टर्स
इज
के लेवल पे ये प्रॉब्लम है कि वो सोचते नहीं है, वो सब ये सोचते हैं कि ये तो ऐसा हो नहीं सकता क्योंकि इतनी छोटी लड़की है, इसमें क्यों होगा. बट दे मिस द डायग्नोसिस बिकॉज वो डायग्नोस्टिक टेस्ट नहीं यूज करते हैं. और एडोलेसेंट में एंडोमेट्रियोसिस इज नॉट, प्रेजेंटेशन इज नॉट सेम एज इन एडल्ट्स बिकॉज उनमें जो प्रेजेंटेशन होती है दैट इज ऑन द पेरिटोनियल सर्फेसेस and small lesions are there which are not picked up by the normal ultrasound. They are there. If we have to diagnose those things, then we have to take help of the MRI or laparoscopy. So these two modalities no parents will like to have for a young girl. So that is why the diagnosis is delayed. But once the adolescent is not responding to NSAIDs and her quality of life is being affected, then the clinician should put her foot down and should insist for such investigations so that the proper diagnosis is there and we can prevent. If the diagnosis is early, then we can prevent the progress of the disease and its complications we can prevent.
I will go a step further. I find, once you find that the patient has been brought by the parents to your clinic, her dysmenorrhea is not normal. It is little more than it should be. One thing. You have to be less investigative. You find out and you she'll say कि भाई मैडम मैं टैबलेट देती हूँ, डॉक्टर साहब इसको इंजेक्शन लगवाने पड़ते हैं, कोई फायदा नहीं होता. You clinch the diagnosis that she is a case of an endometriosis. Ultrasound is good enough. MRI in your and our practice, do not do that frequently. And as far as laparoscopy is concerned, previously it was done left and right, but now most of the guidelines all over the globe say that to diagnose endometriosis early, you don't need to put laparoscope.
Yes.
Dr. Sangeeta, anything else you want to add up for a diagnosis?
Yes, ma'am. A diagnosis. I would like to first convey the message to all the parents and all the young adolescent girls themselves, their family doctors, pediatricians, that from presentation to diagnosis, the time lapse is very important. So once they have guts to present with their symptoms to us, we should not delay the diagnosis. As madam correctly said, the diagnosis depends upon the case to case basis, the whether the girl is agreeing for the local examination or not. Means our local examination along with PSPR is again a clinching diagnosis, and that depends whether that case is prepared to get the PB or PS or PVPR examination or done. After that exam, because in any patient who is having pain during, means young women who are married, if there is a pain during there is a history of dyspareunia, which is quite a presenting symptom in these cases.
Let's not talk about dyspareunia. We are only talking of young teenage girls.
I agree.
And we are not doing PS and PB. It is a clinical examination. We are doing it.
Ma'am, I
Detailed
agree.
history is very important. Detailed history will give us the clinch.
And if patient is willing, then clinical examination, and after that ultrasound. And ultrasound may, if there is no pathology, because many a times ultrasound is not clinching the diagnosis. If relatives are agreeing, if guardians are agreeing, and if the patient is really having a severe symptoms that she needs to be, the diagnosis has to be clinched, then MRI. And
Correct.
yes, if the patient is not relieved by anything, and if the MRI diagnosis is not suggesting, and yes, one more thing, where there are symptoms other than menstrual symptoms, that patient is having urination problem, difficulty in urination, or abdominal problems which are not easily explained, then laparoscopy may be required in these patients.
Are there any blood tests available done for clinching the diagnosis, Dr. Renu?
Ma'am, some tests have been, some people have been doing serum CA125, but it is not to be done. It is not diagnostic because it may be raised in other conditions also.
So you've
it is
understood
mainly the
it,
clinical
that
diagnosis, which is
this condition is underdiagnosed, misdiagnosed, and there's a late diagnosis. Now,
And
I'm asking one
undertreated also.
question before we get on to the treatment aspect. Can this particular disease be prevented? Sangeeta, yes or no?
No, ma'am. This disease cannot be prevented. Only its progression can be halted. It cannot be treated, but
Dr. Renu,
complications can be
Dr. Renu.
prevented.
Yes, Dr.
Ma'am, it
Renu.
cannot be prevented, but early diagnosis of congenital abnormalities of the uterus and vagina, if we have diagnosed them early, then we can definitely prevent it. And
Yes, it is not a lifestyle disease, so it cannot be
it is
prevented.
not
One
a
thing.
lifestyle
So
disease.
before
It is
we
not.
get onto treatment, is there any permanent cure for endometriosis? Sangeeta,
No.
yes or no?
No, ma'am. Again, there is no permanent cure for endometriosis. It's a lifelong disease, but again, early diagnosis, proper treatment can prevent us from the progression of disease and her future fertility preservation, which is an important part of diagnosis in a young adult, so that their future fertility can be prevented. So it
So,
otherwise
Dr.
it
Renu,
cannot be prevented.
what are the treatment options for adolescent girl?
Ma'am, treatment options are first is the medical, first and the foremost is medical treatment. And in medical treatment, first of all, we try with the NSAIDs, which is the commonest treatment given to their young adolescents for pain
What is
during
your choice?
periods.
What is your choice?
Ma'am, most of the times we give ibuprofen and paracetamol combination, and most of them they get relief with it. And it is not only the one tablet which is to be given; it can be repeated after 4 to 6 hours if she is not relieved of that pain. But if a patient requires more than 2 to 3 tablets per cycle, then we need to consider revising the diagnosis. And if she is having associated symptoms like urinary painful micturition, painful defecation, or if she is having any other symptoms, then we need to investigate on those points so that exact diagnosis is reached before we keep on saying कि ये तो primary dysmenorrhea ही है, ये तो dysmenorrhea ही है, कुछ और नहीं है. So we
Dr.
may be
Sangeeta, beside NSAIDs, what is the main treatment in hands of
So,
gynecology?
it is the hormonal therapy. So we can give the patient as combined oral contraceptive pills or progestins or only, or GnRH analogs. Basically, in young adolescent, we use the COCs, that is cyclical
Are they
combined
safe?
oral.
Are they safe? Are they safe?
Yeah, they are safe. As far as this part of treatment is concerned, they are safe. And because
they,
again, it is said that when the disease is can be when the young girl proceeds in her future life, then the pregnancy and everything, they will relieve the disease for a time. So
Oh,
they,
yes.
yes, they
So
yeah, so
they control the disease and they prevent the disease progression,
progression.
which should not
So
happen because this progression. But here, any word tip you want to give it to the all the gynecologists as for the medical treatment is concerned, Dr. Sangeeta. Then I will take it from Dr. Renu. मेडिकल
uh,
ट्रीटमेंट क्या पेशेंट को फायदा है क्या
yes.
करेंगे आप उसके पेरेंट्स को क्या बताएंगे उसको क्या बताएंगे कि ये
Asha,
मेडिकल
means
ट्रीटमेंट
the
कंटिन्यू करना है कि नहीं कंटिन्यू
proper effects, side effects of the treatment has to be explained to the relatives, that as the if we give a because once they are all the medications, all the treatments are going to stop the periods. Once the periods are stopped, then only the pain can be controlled. Symptom relief will only come when there is no periods, because we know this is the endometrium tissue which causes inflammation, scarring, and then causes pain. So to prevent this inflammation, we have to prevent menstruation. So all the medication is targeted towards not having periods. As far so they have to be convinced and counseled that till the treatment is going on, our goal is not to have the periods. So this can be continued.
I think the message is loud and clear that the medical treatment has to be long term. It is not to be stopped.
Hmm.
And then only you'll find that the disease control is there and disease progression is not there. Now we find that a lot of safe drugs have come. Safe in terms in the eyes of the so, Dr. Sangeeta, what is your choice of these safe drugs? Dr. Renu, I will take it from you. What are
yes,
the
ma'am.
safe drugs? What is your
Ma'am,
choice?
COCs are very safe if given properly, because nowadays we have low dose pills also, but they are to be given continuously. We don't have to give them cyclically. They should be given continuously so that we can achieve amenorrhea Once amenorrhea is achieved, then retrograde menstruation, as we think, is the cause for it. So that we will be able to prevent that. So COCs can be given. Even nowadays, long-term preparations are there, like long-acting progestins. We can have etonogestrel implants. We can offer levonorgestrel IUDs, which is the last option, because in Indian scenario, most of the girls are not sexually active and they will not accept that LNG IUD. But etonogestrel implants, they are very popular these days and people are happy taking them. So COCs is the first choice because they are cheaper also, and they are easily available. So people can use that frequently. And another drug is Dynogest, which is a progesterone 19 or testosterone derivative, and it is like other progesterones. It causes hyperprogesteronemia and hypoestrogenemia. So when this kind of a state is achieved, then the patient, because it prevents ovulation, so ovulation is prevented, hyperprogesteronemia is there, so the symptoms of pain are not there, so patient is relieved. And over the period of time, we have seen Dynogest has minimal side effects. And the only problem with Dynogest is it cause bone decrease in the bone mineral density, but studies have shown
Again.
that once the drug is stopped, it is reversible. So we do not need to bother about so much about bone mineral density. But once we have to give it for a long time, then we should not hesitate in getting the DEXA scan for these young girls also. So every 2 years, we should repeat the DEXA scan. Plus, we should counsel these young adolescents to take vitamin D supplements regularly, as well as calcium intake should be sufficient so that they do not have this kind of a problem.
So I think, the life of gynecologist has become much better as far as the adolescent endometriosis is concerned. Madam has said that already OCP is have been very widely used because they are freely available in all the government clinics and the hospitals. But people who can afford Dynagist, which is also not very expensive, month's treatment costs almost something like 900 to 1,000 rupees, and which can definitely be afforded by the parents who want them not to miss the school and the college kind of things. We find, we are very happy. Our patients are very happy. They've been continuing whatever they wanted to continue as profession as a doctor, where they continue profession as engineers, and they are pretty happy. Now, coming to the surgical management. Dr. Sangeeta, a word about what is now the consensus and the many guidelines say that the surgery has to be only once in her lifetime. So they should not change the doctors time and again. Once you change the doctors, everything gets changed. And secondly, that doctors should plan a long-term medical treatment. And thirdly, what are the rare indication where the laparoscopic surgery is advised? Dr. Sangeeta.
So, laparoscopic surgery is not at all the first line of treatment as far as adolescent endometriosis is concerned. So, it has to be taken only in the refractory patients where all medical management has failed and there is severe pain to the patient. So, we can say that if we do go stage wise, like mild, moderate, severe, and advanced, that in cases of severe and advanced cases of endometriosis, we need surgery. And where the patient, there are recurrent endometriomas in spite of all the medical management, or if the endometrioma size, ovarian endometrioma size is more
It's
than
big.
4 centimeters, it's big, it cannot be this thing. And along with it, there is other tubal pathology and other adnexal pathology which requires treatment for, and there are adhesions, multiple adhesions causing severe pain, and as well as the severity of the disease and severity of the symptoms which are not relieved, force us to take a course of surgery in the form of laparoscopy. But the laparoscopic should be, the surgeon should be
Adolescent
senior
aware.
enough, aware enough of the adolescent surgery, and the surgery has to be done in a very meticulous way, and post-operative hormonal treatment has to be given to the adolescent girls so that problems are not there in the post-operative and future period.
So to
So
sum up, whenever you find that the ovarian cyst is very large, 4 centimeter to my mind is not to be taken.
Means
Whenever you
larger
find
layer. Huh?
it's larger than this, around 8 to 10 centimeter, then you have to take it. And whenever you find, the patient's symptoms are not relieved, you have to take it. Now, coming back to recurrence, it is said in endometriosis the recurrence is very high. Dr. Chawla, what do you have to say?
Ma'am, recurrence is very high because it is a progressive disease. So, in the beginning, we have already said that the treatment has to be continuous. We cannot treat for a short time and then stop the treatment. So, we have to give her a continuous treatment, even when we have given medical treatment or we have done surgery. If we have to maintain the results of surgery, then we have to give her medical treatment so that she remains in remission. So, because recurrences, it is a progressive disease, and it has been seen that the endometriosis progresses from grade 1 to grade 4 in these girls over a period of 5 to 6 years. So, we have to take into that consideration, and we do not have to give sporadic treatment. We have to give continuous treatment so that they are not troubled again and again. And surgery, we don't need to do again and again.
So one thing is very clear: recurrence is possible, very high chance, and one has to see to it. If you stop medical treatment, it's going to recur. If you do not give, you've not done a good job, and if you've not supported medical treatment after surgery, the recurrence is bound to happen. Now, coming to very simple questions, all parents ask one thing: can diet help in
Yes, ma'am.
control of endometriosis? Dr. Sangeeta?
Ma'am,
Yes, yes, diet can help, but not in control of endometriosis. It is an adjunct to
One
medical
added.
treatment.
Yes.
Whenever the medical treatment we are giving, other things like diet, exercise, stress management, they all are the
So one
complementary
thing is
treatment.
very clear that anti-inflammatory foods have to be given, which are a lot of green leafy vegetables, lot of salads, and plenty of fruits, fish, nuts. All these are the things which are nearly educated, and they should be exercise also should become a part and parcel of them. You also mentioned about that stress somehow worsens the disease, so they
yes.
must be in a loop. Dr. Renu, what kind of support these children need as far as the stress management is concerned?
Ma'am, first and the foremost is counseling of the adolescent as well as the parents. So parents also need to understand that girl is in trouble and she is undergoing a treatment which has to be almost lifelong, unless and until she becomes pregnant, and for that time it goes in remission, but it is bound to recur after she delivers. So this kind of a thing, if parents know, then their approach will not be that rude कि ये तो हर वक्त पेन ही पेन बोलती रहती है. So once the adolescent goes in remission and she knows that the parents are having a soft corner for her and they are realizing her problem, so I think the overall atmosphere in the house will be very good
At
for
the,
her.
at the same time, I think it is good to introduce them to a good
A
uh,
psychologist.
psychologist, and they must be in loop. So whenever she's in distress, you can definitely
It
find
has
an
to be
answer for it.
multimodal treatment, ma'am.
Yes,
Multi-specialist
yes.
involvement has to be there.
So, the internet is YouTube is tubers is 98% of time for a medical treatment. It is the non-medicos who flood the YouTubes, and they say that acupuncture and various kind of therapies are going to help. Dr. Sangeeta, what you need to say?
Again, my statement is the same, that all these things can
Alternative therapies.
alternative therapies can help to decrease the symptoms, but they cannot be the first or main line of treatment. The main line of treatment has to be followed along with us. Yes, there can be regular exercise, balanced diet, adequate sleep. Adequate sleep is also required, and stress management, but not every time that this heat therapy or physiotherapy is going
She
to
requires a medical therapy by
it
proper
requires a medical man.
gynecologist.
That is the rule of thumb, that without any medical management, these type of therapies are not going to help the patient.
So I think we are summing up again. The mental health of this particular patient is very important. They get into problems of anxiety, depression, and that need to be taken care of. And at the same time, she has to be counseled. The people around also have to be counseled for the same. Dr. Renu highlighted just now that pregnancy temporarily cures endometriosis, but some medical treatment has to be given for subsequently, otherwise disease is going to come back. Now people talk about it. Whenever a young girl comes to you, you girl must get an AMH and you must advise them on social egg freezing. Social egg freezing is not for endometriosis. It is not social egg freezing. But whenever there is a patient of endometriosis, we advise them that they should freeze their eggs. Why, Sangeeta, this particular advice has
Yes.
become very, very important, and all gynecologists should become conscious about this.
So, taking care of the future fertility is very important in young adolescent girls. It is the disease which decreases the ovarian reserve. First, by decreasing the tissue stroma, ovarian stroma, there is decline in ovarian stroma. Secondly, the quality of the eggs as the disease advances. The whatever the quality of the egg was in young adolescent girl, the quality of egg deteriorates later on per se because of the disease. And thirdly, if there is any surgical procedure when the patient in later in life develops ovarian endometrioma, and there is a ovarian surgery which will further reduce the number of available oocytes. So telling them about this is the story of the ovary, but there can be adhesions in the tube, there can be peritubal adhesions, peri-ovarian adhesion, which may also affect the fertility. So these girls are advised to take the treatment, and gynecologists should take care their ovarian reserve also. And there if there is severe disease, if there is going to be the disease is progressing very fast, they have to be advised either by oocyte preservation or ovarian tissue preservation. Both the things can be done.
I think, Sangeeta has tried to say that whenever these patients come, they have a tendency of a decrease ovarian reserve. तो
Yes.
पेशेंट यंग है, जब इन्वेस्टिगेशन टिक करते हैं तो एक एएमएच भी टिक कर लेने में कोई खराबी नहीं है. एएमएच करना चाहिए जब भी पेशेंट्स आपके पास different type of gaps is there, and it is good that they must be advised right in front of parents की इन बच्चों का ओवेरियन रिजर्व कम है. अगर फ्यूचर फर्टिलिटी में आप कॉन्शियस हैं और बच्चा पढ़ना चाहती है, बच्चा करियर में अपना डॉक्टर बनना चाहती है या डॉक्टर इंजीनियर बनना चाहती है, कुछ भी करना चाहती है, इट इज गुड दैट दे शुड सेव देयर एग्स व्हेन दे आर यंग. डॉक्टर रेणु,
Yes, ma'am.
what is the age when they should be saving eggs?
Ma'am, whenever if we feel that she has to undergo surgery, the disease is so severe, so then eggs should be preserved. Because once surgery is, as Sangeeta has already pointed out, once they undergo surgery, the ovarian reserve is going to decrease further. So there is no age bar for preservation of the eggs. The earlier they do it, the better egg quality we get. So as the disease progresses, the quality of eggs deteriorates, as has already been mentioned. So we have to take
So
care that
sensitization must be there to the
yes,
patient
ma'am.
as well as to
Counseling of
parents.
the
Now
parents
I'm
as well as
asking,
the adolescents.
yes, I'm asking one question. Can a teenager with endometriosis live a normal life? I'm asking Renu and then Sangeeta. Short, because we have little time left now. Can she lead a
Yes,
normal life?
yes, she can lead a normal life. We have to
If the
give the
treatment is disease is picked up early and the medical treatment is properly planned, she has been advised about the lifestyle changes, I'm sure she can definitely,
yeah.
with the proper treatment and lifestyle changes and the emotional support, this young girl can lead a normal, active life. Normal,
Yes.
active life. The question I'm asking again, Renu Chawla, do all patients of endometriosis need medical treatment to conceive?
Most
Or
of
you've
them
seen
they
patients
require.
conceiving?
It depends if the disease is more than moderately severe. In those cases, they require assisted reproductive technology. But in cases of mild disease, they do not require any assistance. They
So
conceive on their own.
people, young girls should not get worried about it. If their disease is controlled, they will readily conceive. Yes, in comparison to the people who do not have endometriosis, their fecundity or chances of getting pregnant is slightly less. But the people who have an advanced disease will definitely require help. Now, what is the message to the parents you wish to give? What they can do to help their daughters, as far as this endometriosis problem and the severe period pain is concerned. Dr. Sangeeta, will be your advice to the parents?
So the main role comes of the parents as far as this disease is concerned. First is, again, I will say that early importance to be given to the symptoms of the girl so that disease could be presented. Then they should not delay in the diagnosis. वही as we say कि नहीं डॉक्टर के पास नहीं जाना, MRI नहीं, अल्ट्रासाउंड नहीं कराना, डॉक्टर को नहीं दिखाना. This is normal thing. So they
दवा
have
भी
to
नहीं
be
खानी.
aware of the symptoms of endometriosis. It can present in some cases. It is said that before periods also the disease can present. So one has to be very particular about these symptoms. Second, thirdly, then medical management should not be delayed, and proper comfortable atmosphere to be given in the house. They should not think ये तो हमेशा पेन में रहती है, घर में कुछ काम नहीं करती, कुछ हेल्प नहीं करती. So they should not be neglected in the house. They should be, their disease has to be understood by the parents, and they should support her totally in her life management.
Dr. Renu, how can school support students with endometriosis?
Ma'am, schools, once their absenteeism is there, they should not think that this girl is psychotic and she keeps taking leave. She
I
doesn't
think
want to
class
study.
होनी चाहिए टीचर्स के लिए भी.
Yes,
टीचर्स के लिए
that's
भी
why I
ओरिएंटेशन
told.
होना चाहिए. टीचर्स का भी लो थ्रेशोल्ड होना चाहिए. उनको भी पता होना चाहिए कि अगर गर्ल बार बार ऐसे एब्सेंट हो रही है और स्कूल में परेशान रह रही है, एक्स्ट्रा करिकुलर एक्टिविटीज में पार्टिसिपेट नहीं कर रही है, अपने आप को सोशली विड्रॉ रख के रह रही है, फ्रेंड्स के साथ ज्यादा कम्युनिकेट नहीं करती है, सो दे शुड ऑल्सो इन्फॉर्म द पेरेंट्स कि आपका बच्चा जो है सोशली बहुत पीछे रह जा रहा है और एक्स्ट्रा करिकुलर एक्टिविटीज में पार्ट भी नहीं कर रहा है. तो यू नीड टू नो द रीजन कि उसको पेन की वजह से ऐसा हो रहा है या कुछ और प्रॉब्लम है.
I will definitely share my experience with my daughter's school, and I feel the school should allow flexibility for students experience severe pain, including rest, breaks, and access to the medical assistance in such cases. Now, how the young girls with endometriosis can help their colleagues, Dr. Sangeeta?
Yes, they can, if they know, if they are aware about the disease per se, and they know that their friend is suffering from this disease, so they should make them socially active. As our starting opener batsman said, that मेरे को लगता था बाकी सारी friends ऐसे normal क्यों हैं. So those friends should understand her problem, and they should give her there should be a support system. There should be group support system for these girls, and they should be taken on a positive note, and they all should try to counsel her, help her, and be friendly with her, knowing that this problem is there. So I think they should be quite support.
It should not
Give
be
support
stigma to
her.
the
Yes.
adolescent who has this kind of a
Yeah,
problem.
I think it is a combined duty of a gynecologist, pediatricians, adolescent health specialist, and the support group to provide them medical and emotional help. And I think my caution to all gynecologists is that the high time has come that they must plan medical treatment for a long time. Even if she changes the doctor, or she leaves the city and goes somewhere else for the educational purposes, the roadmap should be very clear for the parents as well as for this particular student who had come to you in her teenage things. So I think we will take up any questions which are if are there in the chat box. This particular thing is for public awareness on endometriosis. I think we three experts have tried to guide adults and girls who are suffering with the problem, and their families, the teachers, and even the gynecologist, how they should go about and handle this particular problem. Adolescent endometriosis, one should not get scared. Dr. Shion, in case if there are any questions, we'll be love to take it.
Thank you, ma'am. We do have some queries, not exactly the questions. So, from our audience. So, the first query is she's a female. So, she have asked that I have been diagnosed with endometriosis in 2014 and had an OT for the same. My pain subsided hence after. However, my marriage at 2018 onwards, my pain came back. So,
See,
one
whenever
question.
you find that the medical treatment is discontinued, the pain is going to come back. Pain is going to come back, and always in a severe form. पहले अगर आपकी एक छोटी लाइन थी तो एक बड़ी लाइन बन जाएगी, बड़ी लाइन बन जाएगी. So the medical treatment has to continue. And I think She should seek the help of a senior gynecologist, and they should be able to help her. Yes.
So, ma'am, there's another last question. Does tea intake deteriorates endometriosis in and its progression?
See, everything too much is of everything is bad. But I think having a 2 cups of tea and 2 cups of coffee, this is okay. This is okay. Green tea ले ले तो बहुत ही अच्छी बात है. But in case if they want to have a conventional tea, I will not say that tea has anything to provoke endometriosis. Thank you very
Thank
much.
you,
I
ma'am.
think Dr. Sangeeta, you want to give any last message to the audience, and then Dr. Reena.
So my last message again to the audience is that it is the role of the parents to the of the young adolescent girls themselves, that they have to come forward and say that this is my problem, this is not routine. So right from the young adolescents to the family members to the teachers, social workers, pediatricians, pediatric surgeons, gynecologists, and nurses, all who are in touch of that young adolescent girl should be well aware of the presentation of the disease, role of early diagnosis, and role of medical management. Everything
And
they
boost
should
up
know.
her moral. Boost up her moral.
Boost up her moral. So I think
Dr.
this
Renu.
disease.
द
Dr. Renu.
एडोलेसेंट शुड नॉट हैव अ गिल्ट कि मेरे को ही क्यों हुआ. ऐसे गिल्ट की फीलिंग उसको नहीं दिलानी है कि तुम ही ऐसी हो, तुम्हें ही पेन होता रहता है. सो पेरेंट्स काउंसलिंग इज वेरी वेरी इंपॉर्टेंट. पेरेंट्स का रोल एक ये भी है कि एडोलेसेंट पढ़ाई में बिजी है, एक्टिविटीज में बिजी है, सो दे शुड कीप अ चेक वेदर शी इज कंटिन्यूइंग विद हर ट्रीटमेंट और नॉट. शी शुड नॉट लीव द ट्रीटमेंट इन बिटवीन कि मैं भूल गई थी, मैंने नहीं खाया और बहुत सारे दिनों तक फॉलो अप में भी नहीं गए. इट शुड नॉट हैपन. So it is responsibility of the adolescent as well as the parents, and teachers also should see to it that she is in continuous treatment and she should not drop out from the treatment, and she should be involved in all the activities in the school as well as socially wherever it is required.
So the last word I will say, let's request all girls who have an endometriosis problem that do not struggle yourself silently. Please speak to your parents, seek the help of doctors, and now they have plentiful to offer you to remain disease free and not have a progression of the disease. Thank you very much, Med Talk. It had been absolutely great pleasure for us to share it for public awareness.
Thank you so much, ma'am. It's our pleasure that you have choose our platform to share this wonderful views and also to conduct podcasts like this. Thank you once again. It's been a
Thank you very
wonderful
much.
session.
Thank you
Thank
very
you.
much.
Thank you.
Thank you, ma'am. Good night.